Hi everyone. Today we will study about the osteology of clavicle. Right. Clavicle. Our video is divided into the five main parts. In the first part, we will study about the overview of clavicle. The second part, site termination. Third part, the features of the shaft. Fourth part, features of the ends. And the fifth part would be the clinical conditions. Right. The first part is the overview of the clavicle. So clavicle is actually a long bone. Number one. Number two, clavicle connects the axial skeleton with the appendicular skeleton. Let me show you. You can see here this whole lot in the black area. The black area, the rib cage, the manubrium, or the sternum, and the vertebra. These all are the part of axial skeleton. Here are the clavicle, scapula, humerus. They are the part of appendicular skeleton. Right. So in this way, even though clavicle itself is a part of appendicular skeleton, but clavicle helps to connect the axial skeleton with the appendicular skeleton. In this way, clavicle helps the free movement of the arm, upper limb. Right. At the shoulder joint. Number one, and the next is the clavicle transmits the weight of the upper limb to the sternum. The weight of the upper limb to the sternum, like upper limb is connected to the sternum, right? Then is the bone the bone itself has two parts, right? One is the shaft, and the other is the end, right? So this is all about the overview of the clavicle. I can revise it like that. Clavicle connects the axial skeleton with the appendicular skeleton. Number one. Number two, clavicle is a part of a shoulder girdle, clavicle and scapula. This is scapula, right? Number three, clavicle has two parts, shaft and ends, right? Number four, it helps to move the upper limb. It helps the upper limb to move independent of the axial skeleton, independent of the chest. We can move our arm anywhere, irrespective, without moving our chest, right? So there is a full movement of the arm at shoulder joint because of clavicle. Then number five, clavicle transmits the heavy forces from the hand to the axial skeleton. Right. There, when someone falls on the outstretched hands, let me show you. When someone falls on the outstretched hands, the strong, even the wrist joint can be fractured. But the main thing which I want to tell you right now is the strong force is transmitted from the upper limb to the clavicle, and the clavicle bone gets fractured. Right. Similarly, if someone falls directly to the shoulder joint, the strong force from the humerus to shoulder joint can reach the clavicle and can also fracture clavicle. The third part is if some kind of thing or any kind of bullet or some kind of like stab or like knife, which directly is directed toward directly clavicle, can fracture clavicle, right? So these are the three conditions which clavicle can get fractured, right? I'm very sorry for that. I told you I will teach the side termination first, but I think I should teach the features of the shaft, and then the features of the end. At last, we'll study on the side termination, right? But it would be then more easier for us. So first of all, you can see this is the shaft of the clavicle. The clavicle shaft. Now see, this is the clavicle. If I divide this whole length of the clavicle into three equal parts, such that this is the first part, this is the second part, and this is the third part. Now. And then I am explaining you, this is the anterior border of the clavicle, right? Anterior means front, right? And you can see this border is little bit changed, like from here till here, the border is convex, bulging outwards. From here till here, it is concave, bulging backwards or inwards, right? So if I ask you, can you tell me that how much part of the clavicle is convex and how much part of the clavicle is concave? What will you tell me? You can tell me like that. See, from here till here. This means 1, 2. Total of 3 parts. 2 parts are convex and 1 part is concave. Right? Is this enough? No. We have just explained that 2/3 is convex and 1/3 is concave. And how we will find that which part of the clavicle is convex or concave? Now see, this is the sternal end, right? Sternal end is very big. It is quadrangular, right? So we can say that the sternal end. From the sternal end, the part of the clavicle is arising is 2/3 convex part and the small flat acromial end. There it is the concave acromial end. I will tell you why it is called acromial end. Acromial end is called because it is attached with the acromion process of the scapula, which we will study in the osteology of the scapula. This is called a sternal end because it is attached with the manubrium of the sternum. Right. So So the first 2 points can be on, and I have already told you in the previous video what is the medial end. Medial end means something which is towards the midline. Near to the midline is called as medial, and which is far from the midline is called as lateral. Now, let me show you the real. If you can see, this is a sternum, this is the clavicle, like this. This is the acromion of the scapula. Now tell me which will be the medial end of the clavicle and which will be the lateral end. Correct. This will be the medial end. The sternal end will be medial, which is near the midline, right? And the acromial end would be lateral. So let's revise it. The medial sternal end has two-third convex forward or front or anterior border, right? And lateral means away from the midline. Lateral acromial end is 1/3 from that, 1/3 concave, right? So this was first point. The second point. So now we will study. So when we are studying about the shaft of the clavicle, we study about the medial 2/3 of the clavicle. Then we study about the lateral 1/3 of the clavicle. Right? Okay. So first of all, we will study about the medial 2/3 of the clavicle. What are the features which we can find on the medial 2/3 of the clavicle? See, the medial 2/3 of the clavicle. Now see. This is actually the clavicle which is placed such that this is the anterior border of the clavicle, or medial 2/3, right? Medial 2/3, anterior border of the clavicle, which is convex, posterior border of the clavicle, which is concave. This is the superior surface of the clavicle, which is really smooth. It has no kind of depression or tubercle. Now, the inferior surface of the clavicle, it has two main things, right? Number one, it has a depression, oval depression, which I will show you. And it has a longitudinal groove as well, right? Now see here. I already explained you the interior border, right? This is the anterior border of the medial the medial which I am explaining anterior border. This is the posterior border. Superior surface I showed you previously. Now see, this is the inferior surface. You can see this inferior surface has a depression, which is the impression for, you can say impression or depression, right? Impression for the costoclavicular ligament. What is the costoclavicular ligament? What can you understand from the word costoclavicular? Costo means the rib cage, the bone of the rib cage. Clavicular means the clavicle bone. This means that there is some kind of ligament which connects the rib with the clavicle, right? So actually there is a, this is the first rib, right? First rib, and this is the clavicle, something like that. Okay, this is clavicle. So the first rib is connected to the clavicle here with a ligament. This is called as costoclavicular ligament. Understood? Then there is, you can see this is a groove, right? This is called as subclavian groove. Why it is called as subclavian groove? Because subclavian groove gives the attachment to the muscle, which is called as subclavius muscle, right? So this makes a groove. But also this groove also plays a part in protecting the vessels of subclavian. This means it protects the subclavian vein, subclavian artery, and the nerve to subclavius. I will not say subclavian nerve. No, there is no subclavian nerve. We can say nerve to subclavius muscle. With the nerve, there is a nerve which arises from the C5 and C6 nerve roots. We will study in detail in the brachial plexus right now. Okay, which arises from the C5 and C6 nerve roots and supply the subclavius muscle. We call it as nerve to subclavius, right? So this group has attachment. This group is formed because of the attachment to the subclavian muscle, right? But it also plays a part in protecting the subclavian vein, artery, and nerve to subclavius, right? So this is all. Now, if I ask you, this is a quiz for you, that in some books there is written that subclavian groove, the location of the subclavian groove, they have written that subclavian groove is located in the lateral part of the medial 2/3. Now don't confuse it. Let me write it clearly. Now see, first read the sentence. Subclavian groove, this is subclavian groove, is at the lateral part of medial 2/3 of convexity. First of all, see where the medial 2/3. This is the medial end, sternal end. Medial 2/3 convexity is still here. Now see this green line, medial 2/3 convex. Actually, in the book, they have further divided the medial 2/3 convex area into two parts. The first part they have called as medial part, second part they have called lateral part. So they are saying that the exact location is the lateral or the medial two-third convex part, on the lateral end, on the lateral side, this subclavian groove is present. Now you can see it is a part of this. I hope you understand this, right? Let me summarize whatever I explained about the features of the medial two-third convexity. Number one, it has the anterior border, which is convex, posterior border, which is concave. Superior surface is smooth. Inferior surface has two depressions. One is the costal clavicular ligament depression. Costal clavicular means the ligament is connecting the first rib with the clavicle. Next is the subclavian groove. Subclavian groove gives attachment to the subclavius muscle and also protects the subclavian vein, artery, and nerve to subclavius. Right. In some books, to confuse students, I think, they have said that the exact location of the subclavian groove is, they have not said the medial two-third is present in the medial two-third. Yes, subclavian groove is present in the medial two-third convex area, but to be really exact, we have further divided the medial two-third into the first, second, third. And the second part is having the subclavian groove. The first part is having the costal clavicular ligament, right? So this completes our medial two-third of the clavicle, which is convex and front or convex at the anterior border, convex forward, right? Now we'll move towards the lateral one-third part, which is concave at the anterior border, or you can say it is concave at the front. You can see this is the costoclavicular ligament. See, costoclavicular ligament, letting the costal cartilage with the clavicle bone, right? And this you can see this is the subclavian groove, which is present somewhat here. Subclavian artery and vein, they are being protected by subclavian groove. This is another picture showing the subclavian artery and vein, which is passing underneath the clavicle at the area which is having the subclavian groove, right? We remember these vessels are not present inside the groove. They are just protected. They are just at the level below the groove, right? They are just protected by the clavicle. The thing is present inside the groove is the muscle only, the origin of the muscle only. Here you can see the subclavius muscle. It is hidden. So let me show you. This blue color. This is the subclavius muscle. You can see. And if you really want to know the origin and of the subclavius muscle, I can write it down. The subclavius muscle actually originates from the first rib. This is the first rib. You know, the first rib is having two parts. This is the bony part of the first rib, and if you see the 3D model, you will see this is the costal cartilage of the first rib, right? So, and now I make the clavicle. See, so subclavian muscle is here. Subclavian muscle originates from at the junction between the costal cartilage of the first rib and the bony part of the first rib. It means somewhat here, okay? And it is attached to the medial end, this part, right? This drawing is right. This is just a rough thing that I'm showing you, right? In actual, you can see it is like this, right? And you can see more detail in your anatomy pictures and anatomy books, right? Now we study about the lateral one-third. See, lateral one-third. The lateral one-third is, you can see, it is concave at the anterior border, concave at the front side, concave forward, right? And behind the posterior border, it is convex, or you can say at backwards, it is convex, right? Then it has a superior surface, which is smooth, right? And again, it has the inferior surface, which is rough. The inferior surface has two important landmarks. Number one is conoid tubercle. Whenever the word comes tubercle, this means that something which is raised, right? Conoid tubercle, and the other is trapezoid line, a kind of line, right? Something like that. Now see here, this is actually the inferior surface of the clavicle, the acromial end, and inferior surface. Inferior surface has a raised area, it is called as conoid tubercle, right? And a line is called as trapezoid line, right? Actually, trapezoid line, what is the importance of this part? The importance of this part is that there is a ligament which arises from the conoid tubercle at one side, which is attached to the conoid tubercle at one side, and attached to the acromion, which is of the scapula on the other side. And another ligament is the another ligament which arises from the trapezoid line of the clavicle at one side and attached to the acromion of the clavicle on the other side. So in this way, there are the two ligaments, right? Conoid tubercle and trapezoid lines are actually, you can say, a site of attachment of the two ligaments which are combinedly called as thoraco-clavicular ligament. Sorry, I'm really sorry. It's not the acromion process. I'm really sorry. Very sorry for that. Please correct me. This is the acromion process. See, this is the acromion process, and this green one. This is the thoracoid process. I'm really sorry for it. I'm going to repeat it again, right? So we have studied about the lateral third of the clavicle, which is lateral 1/3 of the clavicle, which is convex at the anterior border, sorry, which is concave at the anterior border and convex at the posterior border, right? Superior surface is smooth. Inferior surface has a tubercle, conoid tubercle, to which a ligament is attached. The ligament is attached from the conoid tubercle till the thoracoid process with the scapula, right? There is a second ligament which is called as trapezoid ligament, right? Which is present, which is from the trapezoid line of the clavicle till the thoracoid scapula. So these both ligaments are combinedly called as thoraco-clavicular ligaments. This means that thoraco means they one part attached to the thoracoid process of the scapula and the other part is attached to the clavicle. Right? I'm really sorry for saying the thoracoid process and the acromion process, right? So I hope you understood the lateral half of the clavicle as well. Now you can see here conoid tubercle, trapezoid line, right? So this was all about the shaft. We have studied the medial 2/3 convexity at the anterior border, features of it, right? And the lateral 1/3 concavity at the anterior border, right? Now we will study about the features of the medial end of the clavicle and the sternal and the acromial end of the clavicle. Now first we will study about the medial end. See, the medial end actually it is quadrangular. It is big in size as compared to the lateral end, which is flat and small, right? The medial end has an articular facet to articulate with the manubrium. Manubrium is a part of sternum. I will show you, right? But there is a small part of the medial end, like you can see this small part, the inferior small part. It touches the costal cartilage of the first rib. I won't say that it articulates with the first rib. In some books, it is written it articulates to the lesser extent with the costal cartilage of the first rib, but I would say that it does touch it. It does not articulate, right? It touches it, right? And the lateral end, this is, you see, the flat lateral end and small lateral end. It articulates with the acromion process of scapula and forms the acromioclavicular joint. And this is the medial end forms the the clavicular sternal joint, right? See here what I was trying to explain you. See, this is the medial end, right? It is articulating with the manubrium of the sternum, so, right? Manubrium of the sternum. And to some little extent, it is articulating with the first costal cartilage of the rib 1. To some extent, it is just touching it. Okay. First thing. Second thing, the lateral end, right? See, this is the lateral end. Lateral end articulating with the acromion process of the scapula, forming the acromioclavicular joint. Acromioclavicular joint, right? So we have now. I will revise what we have studied. In medial ends, we have studied medial end forms the sternoclavicular joint, right? Sternoclavicular joint, sternum and clavicle, right? Sorry. And to some lesser extent, it also articulates or touch the costal cartilage of the first rib, right? Then we studied the lateral end. The lateral end of the clavicle articulates with the acromion process of the scapula, forming the acromioclavicular joint, right? I want to add some more things as well, right? At lateral end, I want to add that there is a joint capsule. You can see this is a joint capsule. Well, this is not a joint capsule. They are the ligaments. There is a joint capsule at the acromioclavicular joint, right? And here you can see some additional features which I want to tell you is that apart from the sternoclavicular joint and the and this is the part which touch the costal cartilage, there is some other features like interclavicular ligament. See, interclavicular ligament. Inter means it is connecting the one clavicle with the other clavicle, right? The first feature. The second feature is, you can see anterior sternoclavicular ligament, anterior sternoclavicular ligament. Posterior is not visible here, but you can just think that part that you can just remember that wherever there is a joint, there will be some ligaments which will strengthen the joint, right? So see, this is the sternoclavicular joint now. So then sternoclavicular joint is having the interior sternoclavicular ligament, posterior sternoclavicular ligament, and the whole lot will be covered by the joint capsule, right? And this you can see, this is the articular disc. Capsule and ligaments are removed to expose the joint. You can see this is a joint articular disc, right? Now I think this is all about the all the features of the clavicle have been covered. Now we will move towards the clinical features of the clavicle. Now see, the clavicle is commonly fractured by falling on the outstretched hand. I have already told you, because the strong force is transmitted from the hand, till clavicle, and it causes the fracture of clavicle, right? The indirect violence. The most common side of fracture is the junction between the two curvatures of the bone. When we are saying two curvatures of the bone, this means that if this is the medial end, this is the flat lateral end, and this is the clavicle. So at here, there is a concave curvature, and this is the let's change color. Concave curvature. This is the convex curvature. This means that the most common side of fracture is this side, right? The side where the two different curvatures, concave curvature and convex curvature, meet. Which is the weakest point? The lateral fragment is displaced downwards by the weight of the limb, and the trapezius muscle alone is unable to support the weight of the upper limb. Now see, I have already told you that we will study the muscles later, right? But just now you can just trust me. There is a muscle which is called as trapezius. It connects from the clavicle tip. So you can see the trapezius muscle is from the back of the skull. The back of the skull, there are protuberance on the skull at the back side, is called as occipital protuberance. From there, from there the trapezius muscle arises and inserted into the clavicle, right? So you can just trust me. So you can just imagine that trapezius muscle, the function is to lift the clavicle upward, right? So now they are saying that if the clavicle is fractured from here, what will happen? The trapezius muscle will try to bring the clavicle upward, but the whole upper limb, our humerus bone, the radius ulna, wrist, and fingers, they are too much heavy that the trapezius muscle alone cannot bring the clavicle upward, or can help to lift the shoulder upward. So as a result, the person who is having the fracture of clavicle, his shoulder falls. I always say it will drip downwards or like slipping downwards, right? Downwards. It cannot be lifted upward, right? So this was the first condition. Second condition is there's an autosomal dominant condition. I hope you know what is autosomal dominant. Autosomal dominant means only one gene from the parent is needed. The parent is needed to have a disease. In this condition, the clavicle does not develop, or if it develops, it is very small. It cannot be it is not functional. So as a result, the condition is called as cleidocranial dystosis, right? The clavicles will be congenital absent, or they are imperfectly developed. And what will happen in this condition? The shoulders droop, right? You know, if there is no clavicle, how can you think that our shoulders will be like this? You know, this is our shoulder, the clavicle. No clavicle, our shoulders will be like this. Okay, there is a drooping of the shoulders, and it can be approximated anteriorly in the front of the chest. You know, if there is no bone here, you can bring your shoulder front as well. Let me show you a picture. See this picture. This boy has not developed his clavicle, right? Cleidocranial dysplasia is a genetic condition. Abnormal growth and development of certain parts of the skeletal system, right? Skull, bone, and teeth, right? But right now, our main focus is the clavicle. We don't need to go in that much of this condition, right? So people diagnosed with this condition, they have characteristics like underdeveloped polar bones, right? Polar bones, you see, the polar bones are absent. So see, this was the location. Normally, clavicle will be present. The chest would be like this, right? This is chest. No clavicle, chest is like this. And hands here. Even you can bring your hand, bring your upper limb towards near, right? Whereas in normal person, you cannot do like that because the clavicle is present. Okay. So this was all about the osteology of clavicle, right? I hope you understood it. If yes, do like it, and do tell in the comment section that which topic of the anatomy you find it difficult, so I can make video on that, right? And the next video will be on some kind of attachments to the clavicle, on the osteology of the clavicle or the scapula, right? And thank you so much.